Good afternoon, everybody. Welcome to today's lunchtime webinar. So obviously we did one last week around QOF and things, and we're going to start doing a few of these around the different kind of QOF domains and that. So yeah, I think we'll probably just get started. So usually when I start these, a few people seem to join because they see it's like past and start joining. So I like to ad lib a bit at the start, but I think we'll go into it. So today we are looking at the heart failure QOF domain. This is for SystmOne practices as well. So we did the EMIS one about an hour ago, so if you are an EMIS practice and you're sat wondering what the hell, then we already did that, and there is going to be a recording available. So this is for the SystmOne practices using Ardens. And just an intro, so obviously I'm Nathan. I'm the training specialist lead. Well, one of the training specialists, I should say. And Mariette is the other one. So Mariette is on this as well. So we'll both be kind of taking you through the resources for this. Yeah, so I think if I'd go on to the next slide, and then so as we always do with these webinars, just a bit of housekeeping. You're probably used to these if you've done any of our other webinars. But just so you know, obviously, because it's kind of open to lots of different practices, your microphone is disabled, and obviously your camera is as well. So, but you can ask any questions on the Q&A. So you obviously got two of us. Whoever's not doing the presenting, the other one will just keep an eye on that. And if there's anything we can share in there, then we will do. So just click the Q&A button at the top. It's the little kind of speech bubble thing. Obviously, if you have any trouble hearing us and stuff, like Mariette and I, we've already tested it, so should be fine. We usually say it seems pretty obvious, but do just kind of, I wouldn't say turn it off and back on again, but come out of Teams and just rejoin, and usually that kind of fixes any problems and things. And we're only looking at about 30 minutes, you know, because these are quite short and sharp kind of sessions just to kind of go over that domain. And we always get this question. This is recorded. It always records automatically. And we will share this with you. So I think if you register for this anyway, we'll have your email address, and we email it out with any resources. So you will get a copy of this. All of these will also be added to our knowledge base, which we'll cover at the end. How to access that, we'll probably put the link in as well and things like that. So there's like a whole recorded webinars page on there that you can watch all of these. So, you know, eventually we'll have a whole library of all of these things that you can revisit at any time or share with any colleagues and that. So yeah, just the housekeeping. Now, if I just move on to the next slide. So what are we covering today? So as I said, the heart failure QOF domain. So really kind of Mariette's just going to go through a summary of what those requirements are. So just looking at the indicators. It's not too bad, this one. Hopefully there's not too many nuances or anything, but as with all of this QOF, there's always sometimes confusion and things. So hopefully we'll make it nice and clear exactly what's going on with this one. And then I'll dive into looking at the resources within SystmOne as much as I can do. So what reports are there that could help you with some of these indicators, and also just the templates. Now, I say it's a brief overview. We always say at the end, training is free. So you can book training. We'll tell you how to do it at the end. So if you want to really get into the nitty gritty of things and you have specific questions that might be difficult for us to kind of answer on a big webinar, then do book training and look at our resources. So please don't think this is it. This is just this overview. But if you want individual training for your practices, and it doesn't even have to be about the heart failure domain, it could be about anything, we will tell you at the end how you can book that. So please don't worry. But yeah, so I'll be showing SystmOne, then Mariette's going to take you through kind of like the Ardens Manager side of things. So all of you using Ardens Manager, especially kind of like the QOF dashboard, just essentially the reports I'm going to be showing you about how you can kind of manipulate that and kind of dive into it a bit more using Ardens Manager. And then I'll just finish off with those next steps. And like I said, how you can get ongoing training and support. So yeah, nice kind of easy session. Now we've started introducing polls to these. So the first one we wanted to do, I'll just click it, I've just disappeared. There it is. So just an idea, I'm just going to put a poll question out there now. If I just launch it, just bear with me a sec. So I'm going to click launch. There's just a question coming up, and it's basically what's your role? Just like to get an idea of who's joining these webinars. So it should have popped up now. So if you just want to put your job role in there, so we've got an idea of who we're talking, and just choose your option and submit. And obviously, if there's anything else, you can let us know in the Q&A. So I'll just let everyone kind of answer that quickly. I'm not going to answer it because I don't know. Yeah, so straight away I can see a lot of you kind of administrators probably looking at kind of like how to kind of code things and that sort of stuff. So I think that's kind of what I expected, really. So we do have some GPs and nurses, practice managers. Yeah, I think kind of what we expected. So with that in mind, I'm going to ask one more question, and it's just literally like, how confident are you all on the QOF heart failure domain? So like, so we've got a scale of 1 to 5, where 1 is totally confused, and 5 being, proper confidence in it and understanding it. So I'll just launch that, just get an idea of where you're all at. Again, there's no right or wrong answer. And then we just get an idea of that, and we'll launch it at the end, see if you've actually learned anything. So, so we'll put that in there as well. So if you want to all answer that, and then that just gives us a nice. So 3. That's not bad. So hopefully we'll bump you up to a 4 at least for those. One person's, well, maybe it's at one person 5%. I'm not going to do the maths there, but and I'll cover you 3%, understand it fully. So you might be able to tell us something. No, I'm joking. So anyway, so that's a good idea of where we're at with that. So I guess I'll hand over to you, Marriott. If I go to the next slide, I'm controlling the slides. So Marriott's just going to take you through the actual kind of the domains. So, oh God, I've gone too far there. There you go. Yeah, over to you, Marriott.
Lovely. Thank you, Nathan, and good afternoon, everyone. So we're going to start off, first of all, by looking at the registers. Now, although you don't get paid for these registers, I think it is really important to understand what the criteria is that's actually putting your cohorts of patients together for these indicators. So with the registers, you will notice that there are 2 different registers available. You've got HF1, which is looking for patients with unresolved diagnosis of heart failure, and this one is particularly for indicators HF007 and 008. There's then a second register called HF3 Reg, which is for patients with unresolved diagnosis of heart failure, where the heart failure is due to reduced ejection fraction. And this one is in use particularly for that HF009 indicator. So that's the basis of the different indicators that you've got and where the patients will be coming from. Next slide, please, Nathan. And we're now going to take a look at those specific indicators. So for heart failure, you've got 3 separate indicators, HF007, 8 and 9. Now I'm going to start with HF008 first, because this one relates to the registers and the diagnosis of your patients. So with this one, it's looking for patients on that first register, so an unresolved heart failure diagnosis, but it has to have been recorded on or after the 1st of April 2023. And that diagnosis also has to be confirmed by an echocardiogram or specialist assessment in the 6 months before that diagnosis date. There is a situation where sometimes you get patients register with your practice after they have been diagnosed, and in that case, where they haven't had that confirmation, so that echocardiogram or specialist assessment, you will then have 6 months from the date of them registering with you to get that confirmation coded onto the record and complete that process. So that particular indicator, that's worth 6 points, and the thresholds are quite high on these ones. So your lower threshold is 50% and the upper threshold is 90%. So that's HF008. We then look at HF007, which is all about the reviewing of your patients. So with this one, again, it's looking at that first heart failure register. So just the patients with unresolved heart failure who have had an annual review in the reporting year. But that annual review has to include an assessment of functional capacity and a review of their medication. So simply recording just that you've done the annual review isn't sufficient. You do actually have to record that you've done the assessment of functional capacity, which relates to your New York Heart Association classification and the medication review code on that one. So that one is worth 7 points. And again, the thresholds are high, so you've got 50 to 90% for the achievement on that one. And now if we look at the next one, so that's HF009. This particular one relates to the medication therapy for these patients. So this one is looking at that second register, which relates to the patients not just with heart failure, but also where it's due to the reduced ejection fraction, who are currently treated with all 4 of the recommended treatment groups. So they must have either an ACE inhibitor, an ARB, or an ARNI. They must have a beta blocker, they must have an MRA, and they must have an SGLT2 inhibitor. So all 4 of those pillars essentially have to be recorded. Now, obviously, for some patients that might be contraindicated, or it might not be suitable, it might not even be indicated, or they've declined it. So do make sure, if that is the case, that for each one of those 4 treatment groups, you have recorded the relevant PCA if that is applicable. And Nathan will show you how to do that when we look at the templates. The one little thing to mention on this one, and this is certainly the case with all medication related indicators, is that you won't actually see your achievement for this one until the final 6 months of the QOF year. That doesn't mean you can't get started on this indicator. So for the time being, make sure that you have prescribed all 4 of the recommended treatment groups or recorded the personalised care adjustment where it's not suitable, so that all those prescriptions can be added to the record. And then from October onwards, so long as there is an active repeat prescription that the patient has claimed, you will then achieve this particular indicator. So this one has got the most points, so it's 12 points, but the thresholds are lower. So the minimum threshold is 20% and the upper threshold is 50%. So hopefully that all makes sense as to what the indicators are looking for and how the patients end up on these registers in the first place. So I'm now going to hand you back to Nathan to go through all of the resources in SystmOne.
Real thanks, Marriott. So yeah, so just kind of with that in mind, I'm just going to go to my SystmOne and just kind of show you first just what kind of reports we have available to kind of help you with some of that, and then just kind of what the template looks like. So I've got my SystmOne open now. I'm already in the folder there, so let me just go back. So we take a step back so we know where we are. So obviously here I've gone up to your reporting and your clinical reporting. So this is obviously the screen where you can access all of our reports that we build for you. And again, you'll probably be familiar with this screen. Like, I don't want to teach you to suck eggs, but in here, you have like my reports, local reports built at your practice, but you should all have access to the Ardens Limited folder, which is obviously all of the reports that we offer you that you can run at any point. So that's where we're looking at. So you all should have access to that. So as you can see, I've already opened up the folder, which is where we can see all of the subfolders. Now, I'm mainly going to focus on the QOF folder that we have available for you to kind of help you with this. Now, I'm just going to scroll down. So a lot of this is in kind of alphabetical order, or all of it is in alphabetical order. And what we want to do is we want to look at the contract section, and you'll notice now we have 25, 26 in there, and we have 26, 27. So just make sure that you're looking at the 26, 27 folder, because obviously this has been updated with the latest guidance, because there's been a couple of changes on this kind of heart failure domain. Now, what I want is this one here, look, contracts 2026 27 QOF, and we've just got some useful reports in here, and I'm going to open up that folder, and then as you probably know, we've got kind of anything to do with QOF. Now we're going to focus on this LTC long-term condition area. We're not worried about smears or vaccinations today, obviously that is part of QOF, but we only really need to worry about this bit. Now some of this, now SystmOne's, and I'll explain this in a minute, but obviously SystmOne obviously comes with your kind of QOF indicator screen where you can get what your registers are, who's left to get each indicator. We are not trying to reproduce that. It's already in SystmOne. There's no point us reinventing the wheel. So I would still expect a lot of you to be using that just to see who's on the register and who's missing outstanding. Now, I can't show you that screen because I don't have a live unit, but I think you should probably be all okay with that. So do still use that to see, the register of each indicator and who's left for that indicator. But what we've done is we've built some extra reports that will help you with those indicators. Now, the first one, and this is really more to do with that kind of the HF009 indicator, but we're going to go to the first option, which is case finders. Now in here, you're probably again au fait with this. There's a lot of case finder reports where we can identify patients that maybe aren't currently on your heart failure register, but maybe they should be, or any other QOF. So that's why they've got all the other QOF stuff in here. But if I scroll down, you will see there's a whole section around heart failure. Now, there's a lot in there. Again, I probably don't need to go through every one because they're essentially saying these patients don't have a diagnosis of heart failure, but they have something going on that might suggest that they've got it. So essentially, things like question mark heart failure as left ejection fraction is below 45%. So if you were to run that as a practice, that would identify any patients that have got that coded, but they don't actually have a code of heart failure. Now, you might have 0 on some of those, which is good because it means that you're doing a good job. But I would say have a look at these and have a look at kind of what, are there any patients that we could be adding to the register to make sure that we're getting paid for them. But the ones that I wanted to just highlight that especially because this is kind of new. I've seen a few questions in our Facebook group about this as well. It's these 2 bottom ones here, especially, well, this one especially. So previously, that indicator also included patients that had obviously the diagnosis of heart failure, but also it was looking at the left ventricular systolic dysfunction. I said that right. That is not on the indicator anymore. It is just reduced ejection fraction. Now, there might be some patients that don't have that reduced ejection fraction coded, but they had the left ventricular systolic dysfunction coded. This is all a bit of a mouthful. So can we see the report that I've got highlighted there is essentially saying these patients might have heart failure, but do you want to code the reduced ejection fraction? And it says consider recording reduced ejection fraction as has the left ventricular systolic dysfunction coded. So that report would help you identify these patients that actually probably still fall into this indicator, but currently they're not because they've got the previous code, I'm going to say LVSD code, rather than the reduced ejection fraction. So that's a really good one for you to run, identify these patients, should they have that code on there, and by adding that code would mean that they are then falling into that kind of HF009 indicator. So that's a very good one. And there is also this one, which is kind of good housekeeping. So this is patients, again, you might want to record whether it's normal, mid-range or reduced ejection fraction, as that has not been recorded. Now that is not necessary for payment. You only need to code that they have reduced ejection fraction for them to appear onto this. But the guidance kind of states that it's good to code whether they're normal, mid-range or reduced, just to help with the patient care. So that's kind of like a good practice one to do as well. But definitely the one above, you want to be running that one and then kind of coding that code to make sure that they're now being captured for that indicator. So that's just with regards to the case finders. A few other things. So again, I've already mentioned this. If I go to the registers, we are literally telling you to go to reporting QOF indicators because your registers are on there. There's no point in reproducing the report there because you can already get it within the QOF indicators. So, we're not trying to kind of reinvent the wheel there. But time sensitive, we also have some useful heart failure reports in here. And again, like Marriott said, where you've got those patients that have registered at your practice and they already have that existing heart failure code, but they don't have the echo or specialist assessment coded, that will need to be coded. And like Marriott said, you have 6 months to get that code onto those patients' records. These reports will help you identify how long you've got left to get that in. So it's all very well just saying you need to code this, but this allows you to kind of focus your attention a bit. So as you can see, anyone falling onto that report when you run it will have less than a month left to get that coded. Otherwise, they're going to be exempt from that. You're not going to get paid for those patients, essentially. 1 to 3 and then 3 to 6. So patients are going to fall through this. They're going to start there from when they register, then move to there, and then finally move to that. So again, it's just you can focus your attention and go, well, let's get those patients in, make sure they're coded, happy days. You'll also see there's one time expired. So once that 6 months is up, they will fall into that. So you can see who you might have missed. But again, obviously this needs to be clinically checked, but it might be worth running that, because it might be that it was coded, they just put the wrong code on, or they forgot to code it, but it was done, if there's evidence. So again, look at that as well, and there might be a case of getting patients and onto that and backdating that code within the 6 months, and then you hit that indicator there as well. So just those to kind of help you with that. There's not much else. I mean, again, the outstanding reports that, again, you've got the missed patients and the QOF indicators. We have reproduced this. We don't do it by chronic disease. We are literally just saying kind of, how am I driving, these patients have outstanding QOF. And obviously you could dive into that and have a look at what these patients are. To be honest, I think Marriott's going to show you kind of Ardens Manager, so you can kind of do a bit more advanced stuff in there, and you might want to use the QOF indicator screen as well within SystmOne, but it might be worth kind of playing with those as well. So again, just some kind of useful reports there. And I think if I went to the achieved one down here, yeah, again, it's telling you to go to that QOF indicator screen. So, we're not trying to complicate things here. I think the main things that you want to be focusing on are your case finders and those time sensitive reports. That will just help you a little bit more with that. So hopefully that makes sense with regards to the reporting. Just want to show you the templates now. Now I'm just going to have to go in the back end here, so I'm going to have to go and bring up the template up. But just so you know, obviously if a patient has a heart failure diagnosis, they are going to have an icon under their name, and that will open up the best practice heart failure template where you can do your consultations and reviews. But if some of you may not know, we've got a QOF template for heart failure. So if I press F, I haven't got a patient open, but let's just pretend I have. If I was to press F12 on my keyboard, and I was to then, I've already got them saved, but if I was to then search for heart failure, there are 2 Ardens resources that will help you with this. And that is the heart failure template here, and it's this little picture of a broken heart with a clock. And then you've also got this red star heart failure QOF template. So the heart failure one is your general best practice doing a consultation. The red star is your QOF codes, but nothing else, which is really useful. And as you can see, I've added them to my favorites list, so it might be worth doing that. Now, I'm just going to show you these templates. I'm going to have to go in another way, but in really what you do is you would double click to open up those templates. Let me just go in the back way though. So just ignore what I'm doing at the moment. But when you bring up that template, I can do a preview of the template. Oh, sorry, I was going to do the QOF one first. So I'm going to show you the heart failure QOF one, the one with the red star first. That will bring up the QOF codes and rules. So basically everything that Marriott just went through on the template. And you can see, look, QOF 26, 27 heart failure. And then you've got each of the indicators 007, 008 and 009. And it's telling you what it's looking for. But it gets rid of all the other noise. It's just the codes you need to achieve each of those. So if you happen to backdate something or do something like that, this is where you could go. So with regards to the heart failure review, you've got the codes that would capture the QOF on the drop down. But like Marriott said, you need to put that kind of medication review in, etc. So again, you've got the codes that would capture that. And again, this is all based off the QOF rules. So you don't have to go searching for the codes. They will be on this template. So it's a really useful place to see all this. Likewise, with regards to when you're diagnosing them. And again, it's like you can see it's telling you there. So, 6 months before entering the register. So it's either, the echo codes, etc. Are all on there. So again, those codes would capture that indicator. Nice and simple. And then just one thing that's worth knowing here is the HF009 one. Like we said, they need those kind of 4 medications or those 4 pillars of medication to help them with this. So again, it says, it's either an ACE, ARB or the ARNI. So it has to be one of those and a beta blocker. And one of these and one of those. Now, like Marriott said, there might be instances where they might contraindicate, they can't take one of those medications. So that's what the drop downs are for. They will allow you to add whether they've declined or contraindicated or whatever the kind of exception code or the personalized care adjustment, I should say, sorry. So the personalized care adjustment codes for each of those are on there. So if a patient could take all of them except a beta blocker, we would be able to go in here and say, whether they've refused it or they're contraindicated, etc. So again, a really good tool to use if you can only prescribe 3 of the 4, you can go there and do that. And you'll notice at the bottom as well, we've got just the personalized care adjustment for everything. So that would literally just, you've got the, they're unsuitable for any of the heart failure, but that would add a personalized care adjustment for everything. Whereas if you do it for the individual ones, it would only do it for those medications. So again, that's it. So we ran out of time already, blimey. And the only other thing to say is you've got the codes that actually add them to the registers. So you've got the heart failure codes if I was to click on that. But remember that reduced ejection fraction code, if I was to click there, it's just telling you what code actually adds that to make sure that they're then applicable for HF009. So again, you've got an easy way of adding those codes. So it's just a really useful template that you can use. Now, what I want to do is just quickly show you the heart failure template for best practice, and I'll hand over to Mariette. So the best practice one, this is what you would get by clicking on the icon under the patient's name that has heart failure. Just want to quickly show you here. It's just a bit more. This is your best bet. It's got everything else. So you have like a diagnosis page where we can code and say, they've got symptoms of heart failure and the echo result shows mildly reduced ejection fraction. Therefore, we're going to diagnose them with heart failure and also heart failure with reduced ejection fraction. So all of that is also going to add into the register, but you've got other best practice things on there as well. Same for the review assessment and review plan. If you're doing a full-blown review, anything with a red star is going to capture your QOF, but you've got everything else on there as well. So just to help you, so doing a full-blown consultation, and that review is just spread over 2 tabs. So again, the plan, look, there's your heart failure medication review code, etc. So again, if you were doing a whole consultation, you'd want to use this, not the QOF template, but the QOF template will just get you your QOF codes. And I just want to show you very quickly, there would be a button to access the formulary on this template. I'm just going to have to go back way. So if I go into the formulary template, as you can see on the heart failure formula as well, you've got the red stars next to those kind of 4 pillars of medications. So, you've got one of those plus that, plus that, plus that. And the idea is, if I went to any of these pages here, it's going to let me know exactly what I need to prescribe. But you've got your red star next to not given. So yes, it's on the QOF template, but I could choose any of the codes on there as well to kind of take them off and make sure, it might be that they can't have that one. Therefore, on this template, I could choose one of these codes to make sure that, you're adding that personalized code adjustment for that one. So it's kind of relatively easy. Use the QOF template for just your QOF codes, use the best practice template for everything, but it incorporates your QOF codes. Sorry, I've rushed through that. We're running out of time. Mariette, shall I hand over to you and then?
Thank you, Nathan. Let me
Right.
just switch screens. So going to very quickly show you where you can access all these things in Ardens Manager. For any of you that use Ardens Manager, within your QOF dashboard, so on the left-hand panel there, if you click on the contracts button and then click onto your QOF dashboard, right at the top of the screen, I'm just on the CVD tab, and then I've scrolled all the way down here to the heart failure section on here. So as Nathan mentioned, all of those different reports, criteria, and everything is fully visible on this particular page on here. So we can see we've got our diagnosis review on here. So that's your HF008 with that echo or specialist assessment. We've also got the 2 review elements here, which is the review with functional capacity, and then that HF009 with the medication that needs to be issued. Just underneath that set, you'll see you've got access to all of those time sensitive reports, so you can fully access those on here, and you've also got a list of exceptions that have been applied for on any of those particular indicators on there. If you're quite used to the QOF dashboard, you'll be quite familiar with it. So you've got these tracker bars here that show you what your progress is, so you can quickly see just how close you are to that minimum and maximum threshold. And you've also got the traffic light system just in the middle on there. Most importantly, though, in the remaining to achieve column, we can see exactly how many patients are left to achieve that particular indicator. With any one of these ones, click the view button to break down this report, and that will then give you access to that patient list that you can use to look at your patients. Just to say as well, for those where there's time sensitive reports available, we have also popped them inside the relevant report. So if you're looking at your HF008, you've automatically got access to any of the time sensitive reports where they have patients on them. Quickly looking at the patient list on here, so you'll notice with the status, you've got some that say done, some that say to do, so that's your achieved and your remaining patients. But of course at the top here, we can just quickly filter them to look at just the ones we want to on here. Within your patients, you've got this button that says view, and this one loads up your single patient view. And the reason I'm pointing this one out is there's some enhanced functionality in Ardens Manager to help you maximize every opportunity with your patients. So we know we're looking at our echo and specialist assessment here, but if I click on my contracts tab, I can have a look and see what other QOF indicators are outstanding. So for this particular patient, they are currently missing HF007 as well as 008. So it's a quick and easy way to maximize that patient contact while you have them. And then right in the top corner, you've got open in, so you can launch their clinical record and carry on with what you need to do on there. So that's a very quick whistle-stop tour of where you would find these resources in Ardens Manager. If you want more detail on this, please do book a training session with us. And for those of you that are not currently subscribers, you can sign up for a 1-month free trial on this one, and we'll share the details with you at the end. And I've also popped the link in the Q&A for you on there. So I'm going to hand you back to Nathan now to finish off for the session. Over to you.
Thank you. Sorry, let me just get my slides up. And I will share my screen. So yeah, so just kind of finish off. Obviously, that's kind of, short and sweet, that session, because it's kind of like an overview. So just we will the support article will be available soon, so we will share that with you. What we'll probably do is email it out with the video as well, so you'll have an access to the support article, just kind of going through this, and just cover things, use these kind of case finders to have a look at your coding to make sure that you're getting patients into that kind of HF009, and just make sure you're using the correct template, like that QOF template for just the codes, and that is purely the QOF codes. So a couple of questions around not all the drop downs have all the kind of patient refused and things. Currently, the only QOF codes that are available on SystmOne that affect payment are on that template. When more become available, we will add them to it. So please don't think we're not going to. We will. I know a few people say, will you add that? If it needs to be on there and it's a QOF code, it will be on there. So rest assured that will be done if any more become available. I think it's just the others don't actually do anything to QOF. So it's all very well saying I'm just thinking, but they might have, whatever the code is and the reason why you added it, if it's not the QOF code, it won't affect payments. So the QOF template only has the QOF codes on it, whereas best practice one will have codes that clinically is correct, but it might not affect QOF. So just worth knowing that as well. And then just kind of with regards to training and support, like we said, if you need to book training, just drop us an email, training@ardens.org.uk, and then we can give you some dates and you can have training on any of the core stuff. It doesn't have to be about this. If you have any support queries or you think something's missing or anything at all, drop support an email, support@ardens.org.uk. We will share these slides with you as well, so please don't worry when we send the videos out. And then the link to the heart failure support article, like I said, is on there. So when you get these slides, we'll provide it there, but you've got a link on the slide as well. So yeah, just those things. Now I don't know, do I have another just basically what other things. So we did an obesity one last week and an introduction to QOF, and so we got some recordings available, so just some other things coming up, so our whole QOF training thing. So 5th and 6th we got QOF for clinicians. In September we're going to do like a mid-year QOF performance review session, so just looking at where you can kind of maximize things and what you might be missing out on. And then our maximizing QOF is always quite popular towards the end of the year, so just kind of going through in a bit more detail some of that stuff, as is our year-end QOF review. So there'll be a lot of overlap with some of those sessions, but we'll be doing them continuously, and you might learn little bits and bobs on those as well. So and yeah, I think that's it. I don't think there's anything. Oh yeah, the feedback. But while we do the feedback, we probably need to do the last poll question. I don't know. Do you want to do it, Mariette, while I'm doing this bit, or can?
Yeah,
so
sure.
I think if you want to launch that, thank you. Sorry. So Marie's just going to see how you are with that, if that's made any sense. I know it's kind of short and sweet, but please know that this will be available to watch back, and the sports article has obviously more nuance as well. We just like to do these overview ones so you get like a gist of it, really. We all learn differently as well, don't we? So some of you might learn from reading it, some of you might learn learn from playing it, but hopefully this is one resource that you can use. So,
Great stuff. That looks like we've moved to mostly 4s and 5s compared to the 1s, 2s and 3s. So that's great.
I was too scared to look, but thank you. Brilliant. Well, yeah, I think that's it. We'll wrap it up. Went over just a bit, but hopefully that's made a bit of sense here. We'll be doing more of these, and you know where we are if you need anything. So thanks for your time, and speak to you soon. Cheers.
Thanks, everyone. We'll hang around for a couple of minutes in case there's any more questions that pop into the chat.